All right, so I just wanted to go over what your spud should have ended up looking like. So as you can see off to the right, that is a correctly labeled spud. So I'm going to just kind of go through each one of the steps and maybe give you a quick review and you can see where you might have gone wrong. So the first thing was that you needed to label anatomical position. So some of you wrote left or right. That was your answer here, but it wasn't a question. It was what is anatomical right and what is anatomical left. And I know looking at this picture, you think that this is the left, right? Because it is your left. But if we were looking at a body part on this person, is this their left or their right hand? Well, if you turned around and were facing this way, it would actually be your right hand. So it's always from the perspective of the patient or the person that is actually the anatomical term that you'd be using. So this is the patient's right side, this is the patient's left side. Okay. So that is how you should have had it correctly labeled, not two options, just one. Okay. So the next one is to divide the abdominal pelvic region into the 9 regions that you learned. Okay. And you just had to use 4 lines, okay, in order to make this happen. So just as a reference here, remember your abdominal pelvic cavity in your abdominal pelvic region, right? We're separated by your diaphragm, okay? So that's kind of the indicator of where you should have like kind of ended your lines. Like some of you ended your lines way up here, okay? And that's just not where the cavity even starts, right? The cavity starts actually like kind of right below where the axillary region is. And that's kind of like your indicator there, okay? Right below the thoracic cavity or the chest cavity, okay? So with 4 lines, you should have been able to make a grid of 9. And just to review is all of these here are actually the right. So the right hypochondriac, right? The right lumbar, the right iliac. And these are all the left ones with the same names, okay? The middle is the one where it all has to, like it's referring to the stomach. So epigastric, epi was your root, meant above. So above the stomach. Hypo meant below, hypogastric, below the stomach region. And then, of course, where your umbilical region is, that would be where your belly button is, okay? So hopefully that makes a little bit more sense, okay? And you didn't have to label it, you just were setting up the grid so that you could put the red X at one point in the surgery, okay? So Mrs. Spud has, or Mr. Spud, depending on who your teacher was, right? Has bruising inferior to the right orbital region. So the orbital region, right, was actually like right around the eye, okay? And um, some people, because it says inferior to the right orbital region. So some people were doing it actually like right on the surface, maybe like up here. Some of you were doing it here, which would have been more of a lateral, okay? But inferior means under or below or away from, okay? Um, so that's the correct location of that. And if it was somewhere in this region below the eye, it was fine, okay? The next one was Mrs. Spud also had a fracture to her right carpal region. Okay, so again, if you think back to a diagram like this, right, the carpus or the carpal region was right where the arm and the hand meet. Okay, so some of you may have put your X here over on the hand, or maybe more on the arm. Okay, and you wouldn't have got credit for it if it was like a test because it actually needs to be in the correct location. It needs to be right where they are actually connecting. Okay, so make sure you guys are a little bit exact with that, even if it takes like a little bit of time for you to move it around. Okay. All right, next is we saw that there was like a serious injury and the leg needed to be amputated. It's a very specific leg. It wasn't just a guess. Okay, so the left leg needed to be amputated. Again, why it was important to have these anatomical directions labeled. Okay, and so this is the left side. So you're looking at amputating the left leg and specifically inferior to the patella. So it just meant the distal end. So it's going to be the lower half, okay, and inferior to the patella. patella is in the middle of the leg usually. Okay, so as long as you guys had your dash line somewhere here to not there, because that's the tarsal, right? So in a really narrow region, right? So between the middle of the leg and right above the ankle, then you would have been fine for this, okay? And then of course your scalpel indicating that that's where you're going to be cutting, okay? So again, just little things that I saw were you guys not, you guys put it too low or too high or the wrong leg or on the foot, okay? All right, next is the patient's spleen was ruptured, and this is where your grid came in handy, right? So you need to place a red X on the left hypochondriac region. A lot of you put it here, but of course it goes here on the patient's left side, okay? And then the hypo was below and chondra was cartilage. So you have all this cartilage right here in your ribs. So it's below the cartilage there. Okay, scenario 3, the patient has a laceration on the anterior side of the cephalic region that is medial within the frontal region. There's a lot of extra stuff there. The main thing is the frontal region, right? That's where you're basically focusing on. Frontal region, forehead, okay? And you're looking at that it's medial, right? So middle of the forehead. And the anterior side of the cephalic is just a little extra, right? It's telling you just the front side of the head. So, and you're specifically looking right here in the middle, okay? Now, some of you made this smaller, that's fine. Some of you moved it over here, but that's not the medial, that's the lateral, okay? So you wanna make sure that you were actually getting this in the correct spots so that you can actually treat your spud. All right, the next scenario was the left thoracic cavity, right? Had a collapsed lung. So you needed to make a transverse cut. Okay. All right, so if you went back to your body cavities, right, your thoracic was, it was a body region and it was a cavity, right? So it's right above the abdominal region. So it's in this area, okay? And the other piece of information that you need to know is transverse, right? So you can see here the transverse is like a horizontal line, not a vertical line, okay? So if you saw here that says left thoracic cavity, right? So you're looking at the thoracic cavity, okay? And then you have to make a transverse cut. So now you know horizontal, right? That's going from the lateral axillary region to the sternal region. Well, if you were, again, referencing this page now, okay, your axillary was your, like, right where your armpit is, and your sternal region was right here in the middle, and for some reason it's not on this picture, but it is on the one that I gave you guys in your slides, okay? So it's right here. So you're looking at going and drawing a dotted horizontal line that goes from here to here. And if you needed to, it probably would have been even more accurate for me to put one extra dash line right there, right? So it's actually completely in the, like, from here, from the lateral side, all the way to the sternal region. And then you just needed to put your scalpel there to show that that's where you'd be cutting, okay? And then the last one was just a superficial wound on the upper right torso. So your torso is the top half of your body, right? And so you just needed to do it on the upper right. So again, right over here, okay, lateral to the mid-sagittal plane. So your mid-sagittal plane is completely down the middle here, right? And so if it's saying it's lateral, right, it's going to be this way, okay? And the reason you would go this way and not this way is because it tells you that it's on the right torso, okay? So here's your mid-sagittal line, right down the middle, okay? And then right to, or really left, but in this case, it'd be on the right side of the potato, okay? You could place your bandage. And if your bandage was placed right here or right here, or, you know, even like over here, it still counted because we weren't that specific on where you needed to put your band-aid, okay? So just something to maybe help you review and understand maybe where you went wrong.